that workplace wellness savings can generate savings if there are workplace wellness programs. This is a systematic scientific study which was published very recently, and it said that there is a 6-to-1 ROI, that is return on investment. See, in any industry, more so in private industry, they don't want to do any welfare. They don't want to do any welfare expenses, but they are open to investment. So if we prove to them that by spending this money, you are ultimately going to save more money, then they will be very open to that idea. And that is the advantage we see in some progressive industries, that the management is open and management supports such programs, whereas in some it doesn't. There is another, which it's not here in this, but there is another study which has been published, which is there with me, but I will not waste my time on that. Now that is a very recent study. You know what they did? They have tracked the stock market performance of 50 companies who have won various awards. There are something like, in United States there are various awards which are available for workplace wellness or the culture of health. So such companies who have won this award from 1997 till 2012. So for over a period of 15 years they have tracked those companies, their profitability. And what they have found is that those who have won awards and those who have not won the awards, that is the differentiation they did. And there they found that such companies have all beaten the stock market. Their share price has performed better, their profitability has performed better. That means if there is a culture of health, then there is a definite advantage, and the company does better, the productivity does better, and also this stock market performance is better. That study has been published. I will use that study because that is something which one can definitely share with the management. And it is a systematic study with all the proof and stock market data which cannot be manipulated. In fact, one such prize or one such award, international award, is that competition is going on right now, and tomorrow morning Dr. Rajgopal is going to present about Unilever wellness, and my colleague is going to present about ideal wellness, because these are two finalists. So such things are still taking place, and that's why there are some enlightened organizations. But that is where we occupational health physicians have to rise to the occasion, and we have to talk to them. Some of you, like Dr. Saad, perhaps you are also aware of the cash project that we took in Reliance Ministries. Now, the approach of the top management is such that if I tell them, if I would call my CEO and tell him that, sir, I want to come and talk to you about a health and safety program, he would give me an appointment. He would say, yes, please come tomorrow at 4:30 p.m. The office closes at 5 o'clock. He'll call me at 4:30, he'll get delayed because of previous engagement. So he'll give me 5 minutes at the end of the day. But when I call the same CEO and tell him, sir, I want to talk to you about cash. We have a program by name Cash. Then he suddenly says, oh, cash, come in the morning. Because that's the approach, that's the change in approach. Because when you are talking of money, then suddenly everybody listens to you. So therefore we have to give such an analysis of our program, such a predictability. Nowadays metrics are very important. Measurements, metrics, numbers. So we have to go to them with these numbers, that this is what are our current numbers, this is what we propose to do, this is going to have such an impact, and this will result into this savings and this expenditure. And if we give that, then probably from most managements we will get a positive. Because everybody is interested in saving money, everybody wants to improve the profitability. But nowadays nobody wants to do welfare. Even government is reducing the expenditure on welfare, like pensions are off now. There is no pension scheme from the government anymore. So that's how.
But Dr. Pingle, do you think that keeping it optional without having any legislation or a government monitoring agency, implementation would be proper? Because I refuse to believe that the private sector is running at a loss in every company. That's just not true.
No, it will not
Even
exist.
the margin of profit will be marginally reduced until and unless there is a monitoring agency which is strict, which can penalize for failures. Implementation will not be that good. Like you gave
That is
reference on the
very true.
United States, I think they have got a very strict monitoring agency.
That is very true. I will just share an example with you. Now I work in a multinational company, global company. So we work in 170 countries. So what do we see? In India, there is no law and no requirement for knowledge workers. I have more than 100,000 employees, but by law, I need not have a physician. I need not have a clinic because there is no law, it's not required. Only for manufacturing sector it is necessary because there are hazardous processes and it is covered under Factories Act. But for other sector, there is no, it's only shops and establishment act. But when you go to Brazil, when you go to small countries like Philippines, there are acts which say if you have more than X number of employees, then you need to have these facilities. Somehow these things are not there in our country. For a long time, we did not have a workplace safety policy. Now, that policy was sanctioned in 2009. And today we are in 2014. In this 5 years, but it's still only a workplace health environment policy is there, but no programs have come about in that policy. So we definitely need government there has to be an accreditation body, there has to be this thing. And that is where IOH is working. It is working with government, it is doing advocacy, it is trying to implement these things and it is trying to grow. But again, it's being a voluntary organization, it has its own limitations. But we need that. Unfortunately, this occupational health has to become a felt need of the people. Because we are in a democracy, what is relevant to the people should become important. Unfortunately, what is perceived by the people as relevant becomes important. So accidents become important. So an industry, wherever there can be an accident, will definitely have a medical officer, will definitely have a doctor. Because accidents can be seen. But they will not have an occupational health program because as I showed in one of my slides, the latent period is very long. It's only after 10 years, 15 years, 20 years that you will see the effect of occupational hazard. And that's why it is not there. So that is why we need to educate our management, we need to educate the people in general, and IOH is even trying to have this thing introduced in engineering colleges and schools. Even in medical colleges today we don't have enough occupational health, it's only one chapter in PARC, in preventive medicine that we are taught at all, if at all.
Don't you think we have to make ourselves more aware about it, the medical
Absolutely.
fraternity?
Absolutely, and that's why I appreciated Dr. Shyam. In fact, he has been after me since a year, and it's not that you all need to be taught about occupational health, but I thought this would generate some interest and there will be a renewed thinking about it. That's why I accepted his invitation to come and talk about it. It's not that you did not know all these things, you're all learned people, you know it very well.
Safety workplace.
So, thanks a lot. And since we have some time, there is something I wanted to